तुमच्या इथे आवाज कमी करा. Good afternoon to all, and welcome on behalf of Maharashtra University of Health Sciences, Nashik. Today, we are going to discuss antenatal case, and for that, we have panel of experts. Dr. Mansi Kathale is here. Then Dr. Vishala is here from Kolhapur. Dr. Anita Agre and Dr. Khoth are available with us as our experts. And to present today's case, I would like to invite Dr. Shivani Vibhute. Dr. Shivani Vibhute. Dr. Shivani, please share your screen. Dr. Shivani, please share your screen.
Am I audible?
Hello? Am I audible?
Yes, ma'am.
Okay. Yes, madam.
Hello,
Viewpoint.
am I audible?
Yeah, Shivani, you
आणि
are.
हे जे येते बँडविड्थ लो तर त्याला काय करू?
Dr. Shivani,
Yes, ma'am.
please share your screen.
Yes, ma'am. Good afternoon, ma'am.
Yeah, good afternoon.
Ma'am, shall I start?
Yeah, please start.
Okay. Good evening to all the dignitaries and all the PG scholars, the UG students, and everybody who is attending this online clinical meeting on antenatal care, which is organized by Maharashtra University of Health Sciences. I am Dr. Shivani Vibhute, PG Part 2 scholar from Motiwala National Homeopathic Medical College and Hospital, Nashik. And today I'll be presenting a case report of an AFP subject. So we begin with the case. The name of the patient is Mrs. AL. She is a 24-year-old female, and she is a primary gravida with 24 weeks period of gestation, and her LMP was 27th January 2023, and by the calculation of with the help of Naegeli's formula, we reached the expected of delivery as 2023. So now we proceed with the chief complaints of the case. The patient presented with backache in lumbosacral region, that is in the lower back, since the last 3 months. And also patient had fatigue and weakness since last 4 months. With it, the associated complaints were difficulty in passing stool, for stools, which had started recently since the last 2 to 3 weeks. And there was also occasional nausea with low appetite. This case was taken on 17th of July 2023. And now the history of chief complaints. The backache, the onset was gradual, and she had it since the last 3 months at the lumbosacral location with a sore bruised sensation with modalities that she had pain which increased from rising from a sitting position and also from physical exertion. And she was better when she laid down on the back and mild pressure was applied. The second complaint was of fatigue. The patient already had a history of fatigue and weakness before she was pregnant since her marriage, and therefore it continued in her pregnancy also. So the duration was since the last 4 months, and the sensation was that whenever she rested after a slightest physical exertion, she used to feel relieved. And there was also slight dyspnea on climbing stairs, which can be physiological also during pregnancy. And the modalities were aggravation by physical exertion, by standing, and she was better by lying down on the back and by rest. So now the next point is obstetric history. The patient is a primi gravida and there is no history of abortion. Also, the period of gestation is 24 weeks. The menstrual history, she has amenorrhea since last 6 months with LMP 27th January 2023. And there is nothing specific in the past history. On general examination, she had a pulse rate of 98 beats per minute. Her blood pressure was 100 by 70 mm of Hg. Respiratory rate was 20 per minute. She had mild pallor over the conjunctiva. Her tongue was also moist and pale, and the nail beds were also pale. She was febrile at that time with a temperature of 97.6 degree Fahrenheit.
You are not audible.
Hello.
You are not audible.
Hello.
Hello.
Ma'am, am I audible?
Yeah, okay. Now you are audible.
Okay, ma'am. Okay. So the temperature was 97.6 degrees Fahrenheit at the time of visit, and there was no evidence of edema on the legs. On systemic examination, there was nothing abnormal in the patient. The cardiovascular system, the central nervous system, also the respiratory system were all working in apparently normal condition. Then on local examination of the back, there was mild tenderness on the lumbosacral region. There was no evidence of any swelling or redness. Then on obstetrical examination, on abdominal examination, when we inspected the patient, the abdominal distension was noted with stria and prominent linea nigra. On palpation, the fundal height was palpable at the level of umbilicus, and there were changing fetal positions also. Then on auscultation, the fetal heart sounds were heard at the right lumbar region on Doppler with fetal heart rate of 157 beats per minute. Now we move towards the differential diagnosis of the case. So uterine fibroid might be a differential diagnosis, but as we have already taken the USG reports plus the pregnancy test of the patient, therefore this diagnosis is ruled out in this case. The next is osteomalacia, which happens due to vitamin D deficiency, and it is common during pregnancy. But in osteomalacia, we have a bone pain, and the sensation of bone pain is very different from what the patient was presenting at that time. The patient was presenting with a sore bruised pain in the back, and also the location of this case was very specific, which was only on the lumbosacral region. And in osteomalacia, we find that the pain is also in the joints, in the thighs, and which is extending toward lower limb. But there was no such evidence in this case. So therefore, we ruled out osteomalacia. And the last is pelvic girdle pain, which is also again present in joints along with back. And in pelvic girdle pain, the time at which it occurs is mostly during the first trimester of pregnancy. It starts since the first trimester only. And we, in this case, we have the patient in the second trimester. So that is why pelvic girdle pain was also ruled out. Since the intensity of the symptoms in this case is not that much, therefore, we can diagnose it as lower back pain in this case. And now the investigations. So as on 17th of July 2023, the day the patient visited to our OPD, the hemoglobin percentage was 10 gram%, and all other parameters were in normal range. Also, the VDRL, HBS, AG, and all other tests, HIV 1 and 2, were also negative and non-reactive. And the random blood sugar level was also under range. And on USG, as dated on 17th of July again, the gestational age of fetus was 24 weeks, 3 days with adequate liquor and with fetal weight of 790 gram. Placenta had a posterior location and there is grade 2 maturity as calculated by the help of USG. The expected date of delivery is 30th November 2023. This is the USG report of the gravid uterus dated 17th of July. So the final diagnosis of this case is anemia with low back pain in a prime gravida with a period of 24 weeks of gestation. Thank you.
Thank you, Shivani. Now to discuss this case, we have Dr. Mansi Kathare, Professor and Head from Obstetric and Gynec Department, Dr. Vasantrao Pawar Medical College, Dr. Vasantrao Pawar Medical College, Nashik. Ma'am, welcome. Dr. Mansi Madam is here. Ma'am, you can share your slides. Hello. Ma'am, please share your slides. Yeah.
Yeah. Should I share this slides?
Yeah, ma'am, please share.
Yeah, because I was not able to hear you in between.
Okay.
Yeah, now I am. Are you able to see, madam?
No, ma'am, your slides are not visible yet. अरे मला घ्या ना मीटिंग मध्ये. डॉक्टर गीतांजली.
Recording in progress.
Screen sharing has failed to start. The window you selected is invalid. Okay.
कोणती सिलेक्ट करायची ती आपली कोणती
मला नाही माहिती.
मॅडम मी शेअर करू का तुमचे
करा 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 करा. Yes, no problem. You can share.
ओके.
Yeah. नेटवर्क कनेक्शन कुठलाय त्याला विचार. Zoom वर.
Hello, Mansi madam. Hello, Dr. Mansi. मॅडम तुम्ही मोबाईलवर जॉईन आहात का? मॅडम तुम्ही मोबाईलवरती जॉईन आहात? अरे काहीतरी प्रॉब्लेम झालाय, काहीच कम्युनिकेशन नाहीये. मी मोबाईलवरनं पण त्यांनी मला काढले आणि तिकडून नाही काढले. काय करा, 100 लोक आहेत. हॅलो, अरे पण हे नाहीये ना, याला काहीच नाहीये, ऑडिबल काहीच नाही. हॅलो, डॉक्टर मानसी. I think there is technical issue. So, can you hear me? Please, anybody, you can reply.
Yes, ma'am, we can hear and we can see you also.
Okay, then no problem. We will go with next expert, Dr. Vishala. Dr. Vishala Turlapati. She is professor of Department of Prasuti Tantra and Sri Rog, Yashwant Medical College, Kolhapur. Dr. Vishala.
Hello, madam. Am I audible?
Yeah, ma'am, you are audible.
Yeah, I have actually logged in from laptop. Again, it is connected. Connection is going and coming. So, if in between any technical problem, I'll just switch off to mobile. Hello, madam. Am I audible?
Yeah, you are audible, but there is echo, ma'am.
Yes, madam. Give me 1 second time. Yes, madam. I have disconnected the laptop. I'll be connected to mobile only. Yeah, we can carry on. Hello, madam.
Yeah, ma'am. You are
Yeah,
visible.
yes, yes.
Yeah.
My laptop, suddenly the net is disconnecting. So please share for me the slides. I'm logged in
No,
with the
no,
mobile.
there is big technical issue from my side. So, so I also joined with mobile. So you can continue, ma'am.
Yeah. So shall I take the slides from the mail on this mobile? And are you sharing or shall I have to share?
You have to share, ma'am.
Yeah,
Because I
give
have
me a
technical
few
issue.
seconds. Yeah. Give me a few seconds. I'll download from the mail and I'll share on it.
Okay,
Yeah.
no problem.
Just
Then
5 seconds.
we will start with the next expert, and then again we will come back to you. Okay?
Yeah. No issue.
Okay. So Dr. Mansi, are you there? Okay. Dr. Anita.
Yes, ma'am. Yes.
So please start your presentation, or you can only orally you can present.
Okay. From my side, I will try, ma'am, for
Okay.
sharing my slides. Just unsupporting document, ma'am. I just start, ma'am. Can I orally start, ma'am?
Yeah, you can start.
Good evening, all of you. Just I am starting without wasting my time in an introduction. I just start from that point. That is the empowering magic of homeopathy in antenatal care. Myself, Dr. Anita Agre from Sharat Chandraji Pawar Homeopathic Medical College, Vadala Mahadev. Underlying etiology, we all know the underlying etiology. So, risk identification, prevention and management of pregnancy related or concurrent disease, and the health education and health programs or health promotion for the couple. We all know the main issue is that during the ANC period, the lady should have face the many problems, and for that purpose, she should prepare for their 9 months or for their treatment. So we give the importance to the ANC period. Then I am starting the diagnosis as per my homeopathy. Always we talk about that there is an uh, taking care of the health of the pregnant lady. But a very important point is that only not taking care physically, but only taking care of their mental troubles or their mental health or their mental issues. So that the homeopathy is very, very useful for that cases. In a ANC period. That time, that lady is facing the many problems like anxiety, restlessness, so that homeopathy can cure it is a better way. For that purpose, I am just starting diagnosis as per homeopathy. Homeopathy can help with the range of common issues during pregnancy, such as nausea, vomiting, heartburn, constipation, insomnia. It also helps with emotional issues such as anxiety, depression, mood swing. Homeopathy can provide the relief without risk of harmful side effects. The proper way of taking the diagnosis or for a diagnosis in a ANC cases. First of all, we discuss on the chief complaints, then physical symptom, mental symptom, lab investigation, and ultrasonography. In homeopathy, believes that the physical disease often has a mental and emotional component. So, homeopathy diagnosis includes physical symptom. Physical symptom in that cases, now this PG student can explain the case in which they she said that there is a low back pain, or patient is provisional diagnosis is anemia and the low back pain, in which there is a physical symptom. In a homeopathy, we are focused on the physical symptom, but like that, we just know the only not physical symptom she is suffering. Physical symptom is a manifestation by the mental depression or some mental factors. Then current emotional and psychological state. In that case, such as anxiety and restlessness, which are included in the current emotional and psychological state, and the person constitution. The first of all, in homeopathy, it is important for the constitution. When we treat the, it is a best procedure to treat such a cases is to treat their parents' constitution disturbances. When we talking about the child health, first of all, we must know about their constitution of parents. When we treat the constitution of her mother or fetus mother, so it is indirectly we treat the child mentality or child constitution. And then diagnosis, in which the constitutional is in homeopathy, the constitutional is in three types. There is carbogenide constitution, we all say that sora. Then hydrogenide constitution, we all say that psychotic. And oxygenide constitution, which is called as a psychotic. In a carbogenide constitution or sora, in which the fear, anxiety, restlessness, functional ailment, and threatened abortion are included, in which we diagnose the constitution of female. From that, we take the symptoms, and after that, we treat that patient. Then hydrogenide constitution included the gonorrheal infection, malposition, and malpresentation. Next, last constitution is a oxygenide constitution. There is in a oxygenide constitution, we say that is a syphilitic condition. Syphilitic condition included the destructive changes, abnormal pregnancy, and habitual abortion. All these are, as per homeopathy, we first of all rule out the constitution, and after that we treat as a patient constitutional medicine. Next point is the 1 minute. Pregnancy is the major physiological process in a woman's body that increase the level of stress on both mind and immune system. So homeopathy is the most ideal form of medicine that enable you to deal with the symptoms and complication of pregnancy. Homeopathic treatment has proven to be effective treating severe ailments, including the morning sickness, headache, and digestive ailment, muscle ache, and other discomfort which are common in pregnancy. Our case is a 6-month pregnancy, and in a 6-month pregnancy, first of all, in a first trimester, the patient is strongly suffer from the morning sickness. And for that, we need to rule out their miasmatic background and their constitutional background. For that, we treat as a treat by the homeopathic medicine. It is a in which there is a best result of homeopathy. Then next point of my slide is a line of treatment in a homeopathy. Third slide from my side. The homeopathic is a holistic approach to healthcare that treats the individual as a whole. When patient comes to our OPD, then first of all, we treat as a patient whole, not only their knee pain and not only for headache. When patient comes in OPD, we treat as a total person as a whole. So individual case taking is very important. In that, taking into account their physical, emotional, and mental issue, it uses the highly diluted natural substances to stimulate the body's natural healing ability and promote the well-being. Homeopathy is a safe, gentle, and non-toxic, making it an ideal choice for pregnant women. Nowadays, we all know there is so many side effects of other medicine which are taken and which are habitually person can be taken, or without a guidance it is taken from the medical, but it is a very harmful. But in homeopathy, when we talk about the medicine, it is a constitutional remedy. First of all, when we taking the giving the treatment to the patient, first of all we search out the constitutional medicine, then miasmatic remedy, And homeopathic dose is a minimum dose. Duration of action is a dose of action is a day to month. It is not taken as a TDS or BDS or for 15 days. It is an when it is given, its action is on a cover the month or days. Then single remedy for the multiple problem. When we given the single remedy, it take the it is a cover not only headache or body ache, low back pain, anemia. It is a constitutional remedy which cover all the their problems, and not given the separate medicine for headache and not given the separate medicine for abdominal pain. For it is a very advantageous point, the single remedy for the multiple problems. Then medicine friendly to fetus and newborn. When we talking about or discussing about the medicine taking in a pregnancy, it is a safe or not, it is a friendly to fetus and newborn. Then root by tongue, it is a not hurtful to the patient, not given IV and not given in a IM dose. It is only given by the oral route, or it absorption is a very fast within a second. Tongue when we put a medicine on a tongue, it is absorbable fast. Then medicine absorption within a second, and treatment is for the root causes. Not only medicine cover the overall or superficial problem, it take the time and completely cure the patient. Then homeopathic medicine don't cause side effect because only a only a minute amount of ingredient is used in their preparation. They work by the stimulating the body healing power. Homeopathy recognize the symptoms, and health are expression of disharmony with the whole person. When patient complaining for any complaints or low back pain, anemia, headache, so in that time the patient have a disharmony in their mind level. So we first need to cover their mind level, and after that she covers their physical symptoms. Then other hand, if the fetus is genetically diseased or receives some hereditary dyscrasias from its parents, no amount of antenatal care and nutrition to be expected mother or hygiene precaution can make the child born healthy, unless the hereditary dyscrasia is removed by the constitutional anti-miasmatic treatment of the mother during pregnancy. Then the best procedure to treat such a cases is to treat their parents' constitutional disturbances before they are expecting to have a child. Then the uses of homeopathic medicine during pregnancy is completely safe. Use a small amount of active ingredients, natural ability of your body to heal and cause the general improvement. And my last point is in which there is limitation, if any, and when referred. In homeopathy, homeopathy is a safe, gentle, effective alternative to traditional medicine for the antenatal care. It can help the women during pregnancy and childbirth, providing the relief for a common issue and reducing the risk complication. But after that, homeopathy also have a limitation in a genetic disorder or chromosomal disorder disease, in which there is a limited scope for homeopathy for curing that cases, and after that life-threatening complication, in which it is a very life-threatening or emergency cases in which homeopathy has a limitation. And then emergency surgical aid, when sometime there is an emergency case for the or it needs surgical help, in that cases homeopathy has an limitation. And after that, last point, there is a prophylaxis, mother treatment and purification of fetus. Advisable to give the mother sulfur 30, 2 globules, and allow to act for the 6 weeks, after which a dose of calcarea 30 is allowed to act for 6 weeks. Applicable to all cases and has the effect of purification of fetus from the soric trait. First of all, there is an and for that constitution or for that sulfur and calcarea 30 can act as a purification of mother and purification of fetus. And after that, I will start my slides or my topics. Madam, Gitanjali, madam.
Yes, ma'am. So
Finish.
I think okay. I think you have finished your part from homeopath and very elaborative explanation from homeopath. Thank you so much, ma'am. Now,
Thank you so much, ma'am, for
okay.
giving opportunity for me.
Please stay with us. We will talk again at the last part. So Dr. Mansi Kathare, she is professor and head from Obs and Gynec department, Dr. Vasantrao Pawar Medical College, Nashik. She is with us to explain modern view for ANC. Dr. Mansi. Okay, Dr. Vishala. Dr.
Yes,
Vishala.
madam. Yeah, please make me co-host. I'll share the slide.
Computer department, please make her co-host, Dr. Vishala Turlapati. She is professor of Department of Prasuti and Stri Rog from Yashwant Ayurvedic College, Kolhapur. Yeah, ma'am, you are co-host now.
Yes, ma'am.
You can share your slides. Yeah.
Yeah.
Hello. Hello, Gitanjali madam. Hello, Gitanjali.
Yeah, you are visible, ma'am.
Yeah. Should I continue or should I wait? You are asking somebody else to first share the screen, na?
Yeah, ma'am. Please
Madam
wait.
Gitanjali,
We will finish
from
from Ayurveda side and then. Yeah.
Okay. At the last, I will talk.
Yeah.
Yeah. Okay. No problem.
Madam, just give me 1 second. I'm sharing the.
There is green tab inferior to your screen. There is green tab share. Click there and share your slide.
Yes. Just because I have logged in from my mobile, it is the document I'm searching because I kept it on the laptop screen. Unfortunately, it's not working.
And very unfortunately, I have big technical issue, so I can't share your slides now.
No issue. I'll share just a minute.
हे करायचं ना मला share. काय? हे काय आहे? हे काय आहे? हे काय? हे तर मिनिमाइज आहे. इथे.
Yeah, your slides are visible. I think slides are.
These are my slides, madam.
Mansi, madam.
Yeah.
Okay, then start. You can start. Dr. Mansi, you can start. Dr. Vishala, wait.
Okay, madam. Let madam start. Time is wasting. Meanwhile, I'll try to share.
Yeah.
Okay.
Yes.
So
please.
good afternoon. So this I have gone through the case of your student. The diagnosis in her case, she is a priming gravida with 24 weeks of gestation with mild anemia because her hemoglobin is 10 gram. And her complaint of backache as such is, I think it is not related to some gross disease. It is a symptom in relation to pregnancy That may be her complaint. Okay. So now the components, as you know, when a patient comes to the OPD, antenatal OPD, our aim is to first is,
Ma'am, please make it as a full screen, please.
wait a minute. Yeah. Yes. Show desktop. Okay. So it is not getting full screen, madam. I am trying to get it.
Okay, okay, ma'am. Continue, please continue. No problem.
Okay. So our aim is to confirm the pregnancy, assess the gestational age, identify and treat all the high risk factors, monitor well-being of mother and baby, and manage the minor complaints with the pregnancy. And at the end, our aim is to have a safe delivery of the baby. So as you know, in this patient, complete history is very important, because why her hemoglobin is so low, we have to find the cause. So complete history, examination, systemic examination, general examination, as she has told, there is a pallor and tongue is also pale. Systemic examination, no specific findings. Obstetric examination should be done completely. And now investigations are very important. What are the antenatal visit schedule? We have to tell her what are the antenatal advices, immunization, and warning signs in pregnancy. So in history, we are taking complete demographic findings such as age, name, age. Here most important is what is her occupation and what is the socioeconomic status of the patient, and what is the occupation of the husband. Then what are her complaints? As she is having a complaint of fatigue and backache, the fatigue may be associated with her anemia. Then obstetric history. In obstetric history, I would suggest that she has written as A0, P1, G1. Here I would suggest that the score should be written as Gravida 1, P0. She is not yet parity as she has not delivered, and abortion 0. Menstrual history, past history, family history, personal history she has taken properly, and socioeconomic history and dietetic history. So in general examination, these parameters are very important: height, weight, BMI, vital parameters, pulse, blood pressure, temperature and respiratory rate, pallor, icterus, clubbing, cyanosis, lymphadenopathy, edema feet, and thyroid examination. Complete systemic examination, then it is followed by a obstetric examination. Here it is very important because due to anemia, she may have a small size baby or a small for gestational age baby. So inspection, palpation, auscultation, and if needed, a per vaginal examination is also done. The investigations for a routine antenatal patient are a complete hemogram, blood group Rh factor, VDRL, hepatitis B surface antigen, HIV, blood sugar, urine examination, and sonography. These are the visits she has to do as per WHO. First visit in first trimester at the earliest she misses her period. Second visit at 20 to 22 weeks, where we can go for anomaly scan. Third visit at 30 to 34 weeks to see for the growth. Fourth visit at 38 to 40, where we can decide the mode of delivery. Routinely, actually, we advise to come every 4 weeks up to 28 weeks, then every 15 days till 36 weeks, and after 36 weeks, every week till delivery. Antenatal advice is given to a patient who comes to us for the first time. she should be advised to consume, that is first is diet and nutrition. So she should be advised to consume food rich in protein, iron, calcium and fibers. Also advised to take adequate quantities of milk, fruits and vegetables. She should be provided with a dietary supplements such as iron, folic acid and calcium. Iron we don't start from the first trimester, but folic acid should be given to her in first trimester. Antenatal advice regarding sleep is that she has to take a sleep of 8 hours at night and 2 hours rest in the afternoon. The exercise should be a light exercise such as walking. She should not have a hard and tiring exercise or a workload. Relaxation technique should be followed. Daily bathing is advised. Loose and clean clothes should be used. As far as possible, traveling has to be avoided. If needed, traveling should be done in the second trimester. Now, sexual intercourse should be restricted in first trimester and last few weeks of pregnancy. Cleanliness of breast, and if there are any retracted nipples or inverted nipples, they should be first taken care of. Now, immunization, we give 2 doses of tetanus toxoid at the interval of 6 to 8 weeks. First dose of tetanus and second dose nowadays we can give of tetanus toxoid as a Tdap that contains diphtheria and a cellular pertussis. These are the warning signs such as pain in abdomen, bleeding per vaginum, generalized edema, swelling of the face, headache, blurring of vision, decreased urinary output, per vaginum leaking, fever, vomiting, breathlessness and decreased fetal movements. Now pertaining to this our case, first we will have, as I have told you, the diagnosis. Now regarding the diagnosis, she is a primary gravida and she has come in second trimester of pregnancy with anemia. So underlying etiology, I think in this case is mostly a nutritional deficiency. The patient, she has embarked pregnancy and the multiple causative factors are, firstly, there is increased demand of iron during pregnancy. Secondly, if the stores, they are less, in this case, then because of the deficient stores, even if she is having a proper diet, the absorption rate of iron through food is less. It is hardly 10%. So there is excessive increased demand during pregnancy. Near about 1000 milligram of iron is required during pregnancy. And the absorption through food is less. It is hardly 10 to 15%. So if the food is not enriched with iron content and she is not being given with supplements, she will manifest as an anemia. Then secondly, the weight of the patient was also less, where that indicates that she may be having some dietary nutritional deficiency. Thirdly, a proper supplementation of iron-rich food, such as iron-rich food is, it contains green leafy vegetables. Then liver, if she is a non-veg eater, she can take a meat, fish or a liver, but that is not daily taken. And proper supplementation in the form of green leafy vegetables, protein supplements, vitamin C, that is very important. So underlying etiology, I think in this patient, it must be a nutritional deficiency. Now, here we usually require a supplementation with iron. Now, to confirm the diagnosis, we have got different tests. The tests are, first is the hemoglobin level. Now, in this, the hemoglobin level will help to know the severity of anemia. As per WHO criteria, the hemoglobin level should be more than 11 gram per cent. If the hemoglobin level is less than this, we call it as a anemia. But before labeling it as a anemia, we should know it could be the hemoglobin level could be 10 to 0.5% if there is a physiological anemia of pregnancy. Physiological anemia of pregnancy takes place because of there is increase in the plasma volume by 40 to 50%. But simultaneously, the red cell mass, it is not increased up to that mark. It increases by hardly 15 to 20%. And because of that, there is physiological hemodilution. So here the anemia would be of, the RBCs would be of normocytic normochromic. But if there is anemia, underlying iron deficiency anemia, which is the most commonest cause of anemia, there could be a microcytic hypochromic picture on peripheral blood smear. So depending on the level of the hemoglobin, if the hemoglobin is in between 8 gram to 10 gram, we call it as a mild anemia. If the hemoglobin level is less than 7 to 8, it is a moderate. And if the hemoglobin level is less than 7 gram percent, we call it as a severe anemia. So to determine the type of anemia, peripheral blood smear will help us to note the type of anemia, to note any malarial parasite that will help us to diagnose that. Then other causes such as we will have to do other investigations such as red cell indices, which include MCH, MCHC, MCV, packed cell volume, then total iron binding capacity and serum ferritin. So serum ferritin is very important because if the stores are very less, then serum ferritin will be very less. Then very important is serum B12 and folic acid estimation. Because what happens if there is underlying megaloblastic anemia due to serum B12 deficiency, then in that case, there won't be a proper absorption of iron. So these levels are very important. Then stool examination for ovarian cyst. As there is worm infestation, it is very common in our country. The stool examination for ova, cyst and occult blood is very important. Urine analysis for urinary tract infection and asymptomatic bacteriuria. Serum proteins are required for hypoproteinemia. Suppose if patient is not responding to your treatment and still her hemoglobin it remains very low, then only hemoglobin HB electrophoresis and bone marrow examination are indicated, or else there is no need of doing these investigations. Then after investigation, the line of management, line of treatment will depend in this patient as she is in the second trimester and her hemoglobin level is 10 gram. We can suggest her dietary modifications. Now, what is happening, the association of iron and calcium tablets, they take these tablets simultaneously. That should not be taken. So calcium should not be taken consumed with the iron tablet. Iron tablet, if possible, should be taken on empty stomach. Secondly, presence of phytates, presence of tannins, they inhibit the absorption of iron. So the food which is rich in ascorbic acid should be given, which enhances enhancers of food absorption or iron absorption are very important. Secondly, deworming should be done. One single tablet we can give of albendazole. Now, as she is having a 10 gram hemoglobin, I would suggest oral iron therapy. Now, the oral iron therapy in the form of either ferrous sulfate, ferrous fumarate, or ferrous gluconate. These iron tablets, they are of 200 milligram. Ferrous sulfate is of 200 milligram, which contains elemental iron of 60. Out of this, even if the iron 10% is absorbed, 6 to 7% of iron absorption will take place and which will be sufficient for her at this stage. So we will suggest to start with oral iron therapy of any sort. This should be, as I have told, to supplement with proteins, supplement with vitamin C, supplement with B complex. With this, usually it takes near about 3 weeks for the iron concentration, hemoglobin to increase. So we will ask to repeat the hemoglobin percentage after 3 weeks. The first response of starting with oral iron would be presence of reticulocytes on peripheral smear. So that will be, and patient will start feeling better. Patient will be symptomatically better and her symptoms will decrease. Suppose if it is not responding, then and then we suggest a parenteral iron therapy. So parenteral iron therapy in the form of injectable either IV sucrose or intramuscular injections can be tried, but they are indicated only if she is not responding to oral iron therapy. Lastly, depending on the period of gestation, in your patient, she is already in second trimester. So there is no need of any blood transfusion. But if the patient comes at 36, 37 weeks of gestation and her hemoglobin is very low, then the mode of treatment would be a blood transfusion treatment. So now limitations are, suppose if we just go on giving only iron and no other supplement, her hemoglobin may not increase. Secondly, if underlying corrections of and if compliance of the patient regarding oral iron is not tested, again there will be no increase in the hemoglobin. As you know, the patient, when they take the oral iron, if they take after food, the absorption is decreased. Secondly, these oral iron may cause some nausea, vomiting, dyspepsia, and compliance of the patient will be very poor, and hence then again there will be a limitations, and if the patient does not come for routine checkup properly, we can't assess her level. And suppose if a patient at a primary health center or in a referral center or in a setup, private setup comes with a severe anemia and she is in labor, then she should be referred immediately to a higher center, because during labor there are chances that a severely anemic patients may go into failure, and hence in such cases we should refer the patient early to a higher center. So I have shortly introduced your 4 pointers which you have given. Under this case I have discussed with you. So if any questions are there, you can ask me.
Okay, very nice and detailed presentation, ma'am. Thank you so much.
Thank you, madam.
But please stay with us. We
Yeah,
will discuss later. Yeah.
Yes.
So now we have Dr. Vishala. Dr. Vishala.
I will stop sharing my screen now.
Yeah, ma'am. Yeah, you can.
Yeah, madam, please make me co-host.
Computer department. Dende sir. आहात का तुम्ही? Yeah.
मॅडम मी ऑलरेडी मल्टिपल शेअरिंग ऑप्शन ऑन करून दिलेला आहे, त्याच्यामुळे कोणी पण शेअर करू शकतं स्क्रीन.
Yeah, now it is visible. The screen is visible.
No, ma'am.
Madam, I have logged in from my mobile and laptop. That is why two are seen, because there is a connectivity problem.
Okay, then please mute one device.
Yeah, one mute is already, one device is muted.
Okay.
So
no problem.
Now
your screen is visible now. Yeah,
it's visible now. Yeah. So I am directly going to the discussion of the case and its related 4 points: the etiology and the mode of treatment and diagnostic parameters in Ayurveda. Not other details, as Dr. Mansi madam has covered very nicely the routine ANC care and other protocols to be followed in the antenatal period. So in the case presentation, the symptoms which were given, low backache, That is generally we term in Ayurvedic classics as per the Sanskrit terminology as Katishula, and or it is also called as Sakti Sadanam. And the fatigue, that is Shrama or Glani, we call it as in the Sanskrit. So according to the Ayurvedic text, these are considered as Sadyogruhita Garbhalakshanas. That is, these are considered as a subjective parameters of confirmation of early pregnancy or early gestation. So according to our treatise, Charaka Samhita, there will be that is in the physiological sense, they have mentioned Balavarna Hani, this is loss of strength and activities for up to 6 and 7 months, and even it can continue till the period of labor also. This is a very common phenomena that happens in pregnancy rather than seeing it as some pathological condition. And also the term Klanta Tama, that is exhaustion is more prominent or fatigue is more prominent in during the pregnancy period. Particularly the case which has given 24 weeks gestational period. This is more commonly seen in this period. Is it logged in from the other device? Just a second.
Ma'am, just click downward arrow.
No, madam, I think 2 devices are on. No, that's the problem I'm getting probably.
Slides are not moving, no?
Yeah, they're not moving.
But you can press the downward arrow. Automatically will.
No, it's
Please
not.
Okay. Then there is arrow.
Yeah.
Down
I think
the
so.
screen there is arrow. Yeah.
No, it's not
Yes,
moving.
now moving. Yeah. Moving, ma'am. No problem. There is second slide. Chinta, Shoka.
Yeah.
No problem. Yeah.
Yeah, there's other psychological conditions like Chinta, Shoka. These are depressive tendencies which are commonly seen in the pregnancy period associated with the development of this fatigue and this backache, etc. symptoms. And one more causative factor that is most prominently mentioned to present this type of complaints in the pregnant lady is Ratri Jagarana, that is awake in the night, not having proper sleep in the night. And one more condition that attributes to this development of these problems is Davrudavamana, that is not fulfilling the desires of pregnant lady. So as per our Ayurvedic classic, the pregnant lady is having 2 hearts, that is one the mother's heart and the other is the fetal heart. So right from the 4th month, that is around 16 weeks onwards, the fetus starts exhibiting its will and wish through the mother. So if these are not fulfilled, so according to Ayurveda, the pregnant lady can develop this sort of symptoms like backache, excessive fatigue, excessive vomiting. These are the most common symptoms we can see. So diet and lifestyle plays a major role in the provoking already imbalanced 3 forces. So according to Ayurveda, the 3 forces, Vata, Pitta and Kapha, these 3 are the major humoral biological forces which govern the body, whether even in non-pregnant or pregnant, but basically in the human body, these 3 are the governing forces. So whenever there is a faulty lifestyle, faulty diet, particularly these 3 biological forces will get aggravated and they will result into many number of diseases as per the particular causative factor again. So So the symptoms, so pregnancy itself is an imbalanced state of biological forces, which is termed in Ayurveda as Dhatu Kshaya. That is completely, there is a decrease in the general strength of the female. So the particular etiological factors mentioned in the form of diet is consuming very spicy food, which is considered as Ruksha and Tikshna Ahara. That is food devoid of the healthy or unsaturated fats, having spicy character, and exposure to cold atmosphere or cold edibles, and eating cold food, consuming cold beverages. This all will promote the aggravation of the biological forces. And excessive physical strain and excessive coitus. This is termed as Ati Vyayama and Ati Vyayaya. So these also promote in the triggering of this musculoskeletal problems, excessive fatigue during the pregnancy. So another major factor, that is the sitting and sleeping postures also. So Vishama Shayana, that is sleeping in improper posture, Vishama Asana, sitting in improper posture, can also contribute to the development of the low backache. So the subjective symptoms which were mentioned in the case presentation, that is low backache and fatigue. So one important point that should be noticed in the case presentation is there is a weight gain of almost 10 kgs in the 24 weeks period, which is prior to pregnancy, the weight was 38 kgs. So generally in the first 12 weeks, much weight gain is not expected. So considering this point, 10 kgs weight gain looks to be a very significant more weight gain, and it can be a diagnostic parameter because obesity can lead to low back pain because of the muscular pull. So, and the next point, that is bruised sign that is given in the backache. So is there any trauma that is not ruled out? Because generally for the muscular strain or generally the lumbosacral strain of the pregnancy, this bruise or tenderness is not expected. So is there any trauma that history is not ruled out? And the occupational history is also not mentioned.
तिने पैसे दिले मम्मीने लाद्या बसवायच्या होत्या तेव्हा तिने पैसे दिले अशा वेळेस मोठ्या मोठ्या ठिकाणी तिनेच पैसे दिलेत ना आणि तिने स्वतःकडे काही ठेवते का काहीच नाही ठेवत
Dr. Zui. Dr. Zui.
तू दिले असतेस का पैसे तेव्हा तुझ्याकडे होते का ते कुठल्या तोंडाने
Computer department.
तसं तेच बोलले तिला की तू ज्याला कोणाला सांगत होती.
So the basic occupational history is also not ruled out because in rural India, we can see agricultural workers, or in the urban side, desk work, nowadays IT professionals. These are all the abnormal sitting posture contribute to the backache. So this occupational history is not mentioned here, and trauma is also not mentioned. So bruised sign may not be appropriate for just the musculoskeletal strain of the pregnancy. So, and another point mentioned is straining due to hard stools could be one cause, because in the case it is mentioned that patient is straining because of the constipation. She has to strain a lot while defecating. So that could be also one contributing factor for the musculoskeletal strain, and it can lead to low back pain. And growing uterus, which expands and shifts center of gravity and stretches and weakens the abdominal muscles. So this change of posture put a lot of strain on the back. So this is a physiological change that happens in pregnancy. If it has to be considered as a simple backache, not having any other etiology. The extra weight is more work for muscles, where the patient significantly, there is a 10 kg weight gain within a 3 months period. So that extra weight is more work for muscles and increases stress on the back and may feel worse at the end of the day. So this point is also missing in the history, how the back pain is getting relieved. If it is getting relieved after the rest, then probably that is not a pain that has to be worried much. So the Ayurvedic diagnostic parameters, we have to assess the patients with Ashtasthana Pariksha, that is seeing the pulse, nadi, mala, mutra, the characteristic features of the defecated stool, and the urine is in the tongue examination, and how the perceiving of the sound, shabda, how the touch is feeling, sparsha, and drak, how is the eyesight, and these are the basic parameters for the diagnosis to assess which dosha, that is which biological force is more aggravated. And in the Dashavida Pariksha, there will be Prakriti, that is the constitution assessment, what type of Vikriti, what type of pathology we are seeing in the body, and what is the Sarata, that is, there are different Sara, that is the characteristic of the body mentioned in Ayurveda. So whether the body is dominant of Vata, dominant of Pitta, Kapha, what type of body it is, we have to see. Because when we are selecting a drug, according to the body Prakriti, we have to select the drug that plays a lot of role in selecting the treatment modalities or line of the treatment. And the Shamhanana, the tolerant capacity of the patient, Satmyata, what are the substances that they are compatible for the particular patient, and Sattva, what is her the strength, general strength, Ahara Shakti, whether she is having good digestive capacity or not, whether she is having good exercise capacity, and the age of the patient. These are the basic diagnostic parameters we have to see, assess before going to the disease diagnosis. And the Katishula or the low backache, it is explained as a Lakshana also when it is associated or a symptom associated when there is indigestion, Ajirna, and Kshatakshina, that is low immunity and strength. So whenever a pregnant lady is having low immunity and indigestion, because in the case it is mentioned that she is also having loss of appetite. So these two can contribute to the development of Katishula, because the basic controlling force of the three biological forces of the body lies in the proper digestion capacity, or we call it as Agni. In Sushruta Samhita, Katishula is not enlisted as a separate entity or a disease in the pregnancy. But while explaining the conditions due to overeating, Katishula can be resulted, and it comes under purely Vata Vyadhi, that is musculoskeletal disease we can consider. And in the classical text Yogaratnakara, various references we can see on Katishula, and these are all available in the context of also Vataja Arshas. Hemorrhoids can also result in low back pain. Because the patient is experiencing severe constipation, it could be one presentation, maybe their development of hemorrhoids, which is not mentioned. So the final diagnosis we can make is Garbhini Kativata and Dhatukshaya Avastha, resulting in Katishula or Glani, low backache and fatigue. So complications which have to be evaluated in this condition is backache, which is worsening even after taking rest. So we have to rule out any additional pathology is there. So any orthopedic problems are there, we have to rule out as per the condition which is demanding maybe some additional investigations of X-ray. Anyway, it's contraindicated. So if the patient is suffering too much and not getting relief with simple measures, additional investigations have to be advanced. Advise additional methods of investigations. And if any disturbance in the sleep is there, that is also considered as the patient is suffering with the pain more often. And if it is also associated with any complaint of vaginal bleeding, it could be leading to a process of abortion. So that should be given proper attention towards that. And if needed, additional investigation like ultrasound has to be advised. And if the female is pregnant lady is suffering with urinary tract infection, so that is indicated through burning micturition and increased frequency of micturition. And at this time, a urine routine has to be done. And if it is indicating urinary tract infection with more number of pus cells, and according to that, the further treatment has to be carried, because that also may be complicating this backache. And local examination of lumbosacral area. So any tenderness or any abnormal features like any swelling, any injury can give an additional point whether case should be handled with the obstetric department or should be transferred to the concerned department. It will give an indication basing on this symptoms. So coming to the principles of Ayurvedic treatment, the major factor, as I told, lies in the impaired digestion. So correction of Mithya Ahara Vihara, that is avoiding the etiological factors when identified in the diet, Ahara, and in the lifestyle Vihara. So reducing spicy, dry, cold, and heavy to digest food and adding healthy fats to which pacifies the Vata, because this is very important in handling the musculoskeletal problems. And in the Vihara or lifestyle, correction of sleeping posture, correction of sitting posture, and avoiding the excessive physical strain has to be advised to the patient. So patient is having here, in this case, loss of appetite, that is Agnimandya. So basic cause of vitiation of biological forces is Agnimandya, or loss of appetite. So first principle is correction of Agni. So what we prefer in pregnancy, again, the safety also should be seen. So Shunti Churna, dried ginger powder, 1 gram before food, twice daily with honey. It will correct the impaired digestion and Agni. And to correct constipation, the medicine Triphala, which is constituted of 3 important myrobans, they are called. These 3, Triphala Kvata, these 3 fruits, that is Amlaki, Vibhitaki, and Haritaki, these 3 are the important components of this Triphala. So this has to be prepared in the form of a liquid with adding 10 grams of the powder in 60 ml of water, and it should be reduced to 15 ml and can be given at bedtime. So this will relieve the constipation. So once constipation is relieved, appetite is also increased simultaneously. So the pressure on the lower back muscles and ligaments will be reduced and patient may get relief from the backache. And to correct the vitiated doshas, particularly the Vata and Pitta, that is Pitta is mainly here responsible for the decrease of the hemoglobin. So the Adimadi Gruta, which is prepared with the pomegranate fruit, with the cow ghee mixed with the cow ghee, this is also helpful in increasing the general strength of the pregnant lady and also correcting the anemia and correcting the Vata. All the 3 can be done, which can reduce the problem of fatigue, which can reduce the problem of low back pain and also increases the general strength. So 5 ml twice daily of tough food with warm milk, 20 ml of warm milk is advised, and local application of a medicated oil which is called Mahanarayana Taila at the site of pain, and heat application in the form of medicated poultice which is prepared with some herbal drugs will help in relieving the low back pain. So this is for local relief of the pain. And one more medication which is given with the Indian gooseberry prepared with Amlaki, that is Amlaki Rasayana, which is very much helpful because it is rich in vitamin C. So when the patient is suffering with related symptoms of anemia, anyway, the 10 grams hemoglobin which is mentioned, and in the initial presentation, there was excessive fatigue and even breathlessness is also mentioned on going on a walk or having the staircase, taking for a walk also. It is mentioned excessive breathlessness, but I don't think 10 grams hemoglobin, which is a very mild anemia, cannot result into breathlessness on exertion. So that has to be ruled out why the patient is having breathlessness on exertion. Proper evaluation should be needed because 10 grams hemoglobin is not reflecting on the symptoms that are related to the anemia. So here Amlaki Rasayana, which is having rich in vitamin C, which will help in also absorption of the iron, because B12 and vitamin C both are equally important intrinsic factors in the absorption of the dietary iron. So 5 grams twice daily before food has to be given. And how to understand these principles? The Deepana, which is we are enhancing the digestive fire, which improves the Dhatu Nirmiti, that is the developing the strength in the patient, and Uttarottara Dhatu Pushti, that is the 7 important elements of the body will be given strength one after the other so that finally the hemoglobin levels may get increased. And Pitta Shamana, which in form of Dadimadi Gruta we are giving, this will break the pathogenesis and it will also increase the hemoglobin percentage, because that will help in relieving the fatigue and other related problems. And most important point we are giving here is Rasayana Chikitsa, because Amlaki or Indian gooseberry is considered as Rasayana. It will improve general condition of both mother and fetus. Growth will also well promoted. And the Vathara Chikitsa, what we are giving in the form of Dadimadhikrita, correction of Agni, helps in balancing three doshas. As pregnancy is a delicate stage, treatment should be suggested only in a very snigdha, that is a very mild potency and easily digestible medications. And as pregnancy advances, fetal need increases, and the dravata, or the what you call liquidity of the rasadhatu or plasma increases to fulfill this demand. So this causes the malarupa vruddhi of all the dhatus in Garbhini, that is developing the less hemoglobin status physiologically. So the dravaguna in kleda causes Agnimandya and Rasavaha Srotodushti, which is a major tissue element which will help in improving the absorption of the dietary iron and formation of the good RBCs. So this will, because of this dilution, it will affect the development of the RBCs and result into the panduta of thwak, that is pallorness in the skin, nails, netra in the conjunctiva, and also seen in the tongue. So this will result into Garbhini Pandu. So this Garbhini Pandu or the pregnancy anemia is not different than the generalized anemia, only the pathogenesis here differs according to the treatise Kashyapa Samhita. The compression of the related blood vessels in the Garbhini female. So this will result into the development of this Garbhini Pandu because of the dilution of the Rasadhatu. So hence, this is the reason, but the Chikitsa is mentioned in classics can be applied in Garbhini, but without having any Tikshna Shodhana. We should not give any high potency medicines to treat the Garbhini Pandu. So we can make the pregnant lady to have increase the hemoglobin levels in a very smooth and normal way. So we have a protocol of antenatal dietary protocol. So in the first month, 500 ml of milk with, of course, we add with folic acid, and 18 grams of protein, which will be supplied in the form of milk and also from the this soups and other things like protein soups, even like moong dal soup and all we advise. And in the second month, same thing, but 500 ml of milk boiled with the dates. So, and also this will give additional strength that is needed for the pregnant lady. And in the third month, we'll introduce the healthy unsaturated fats. So this will help in maintaining the biological forces normally. Like the same protocol along with the milk, meat soup is added in the fourth month, which is a good source of vitamin B12, folic acid, as well as a good source of protein. So if any non-vegetarian who is not preferring, we can advise the moong dal or the beans, green beans soup, we can advise 70 grams. So this is a protocol we give in the form of diet, so that even in the addition of in the fifth month, we'll give 5 to 10 grams of butter. So this will help in maintaining the healthy fats, which are also important for the absorption of vitamin D. So this will help in maintaining the calcium and vitamin D levels. So the unsaturated fats are also very important in the diet of the pregnant lady. So with this, we can make the symptoms less prominent and make the pregnant lady carry on with the pregnancy period without having any much complications. So when to refer the patient finally, as I have mentioned, if the backache is not resolving with this protocols, and if the anemia is not improving, rather than calling anemia, the symptoms related to anemia, that is exertion, dyspnea, these are all not related to 10 grams hemoglobin. So if these are not getting resolved with this protocol, definitely for the next investigations should be carried on and has to be referred to the proper place where the further investigations will be carried on and further advance diagnosis can be made and to treat the patient. So with this few points, hope I have given the information how we take care of these symptoms in Ayurveda. At this outset, I would like to extend my sincere thanks to Dr. Geetanjali Kerle Madam, MUHS, for giving me this opportunity, and also for listening patiently, all the audience, and for the opportunity allowing me to present here my management and my college dean. I am thankful to all of them. Thank you once again.
Thank you so much, ma'am. So Dadimadi Gruta and Amalaki Rasayan are useful for absorption of iron, right?
Yes, yes.
So, okay, thank you so much. But stay with us. We have last expert opinion from Unani, Dr. Nia Madbi Khoth. She is professor from Dr. MIJT Unani College and Hospital, Mumbai. Ma'am, are you there? Okay, I think she is not there. So we will conclude at this point. If you have any query, you can directly ask to our experts. I have one query for all, that we have to give iron supplement in anemic ladies, okay? But in many cases, it causes constipation. So what to do to resolve this problem?
Madam, she should be asked. Are you able to hear?
Yes, ma'am, yes.
Yeah. First thing, if possible, she should take that iron tablet on empty stomach. One thing. Second,
Okay.
she should take plenty of green leafy vegetables, plenty of water, so that there won't be any constipation. But still,
Okay.
she has got this complaint of constipation, then if needed, we can give her some stool softener. But as far as possible, we don't give any laxatives during pregnancy, because they may initiate reflexly some uterine activity. So we don't want that, and hence routinely we ask the lady to take plenty of fluids in the form of water, juices, milk, everything. And still if she has got a constipation, then we can change the brand. Many a times what happens, some iron salts, they are more prone to cause constipation, and we can change the salt in such cases. And even if with this her constipation is not relieved and she is not tolerating the oral iron, then last resort will be to give her injectable. But as far as possible, we avoid injectable because it has got its own complications. So as far as possible, we can change the salt. Many salts are there. With nowadays, they are giving some salts. There is one preparation known as Fursoft that does not cause constipation. So by changing the salt, it may be helpful.
Hello.
Okay. Thank you
Ma'am.
so much. Yeah. Dr.
Ma'am,
Anita.
in homeopathy, when we prescribe the homeopathic medicine for anemia, there is no side effect, or there is no forming the constipation. So homeopathic drug is safe in that case, and it relieves that such a constipation or nausea. So it is better to give the homeopathy for the increase the iron.
And what are the contents?
As per, oh, sorry. Yeah, go ahead.
What are the contents of medicine from homeopathy?
And it is taken constitutionally. When such a patient is a complaint of anemia, then we take the constitutional medicine for that case. Example, dash ladies suffer from low back pain and anemia in our cases. Then when we taking the history, then mental history, physical history, then miasmatic history, and then we select the remedy for that case, and it is called the constitutional remedy. And
Okay.
and that's that type we give the anemic lady medicine.
Okay. Thank you so much.
And
Dr. Vishala, yes.
yeah, madam. Yeah, actually, we follow the ICMR and WHO guidelines that iron cannot be deprived for the pregnant lady because there is a negative balance from the second trimester onwards. So coming to the constipation, definitely we can tackle the constipation problem with the Ayurvedic medicines. As I have mentioned, Triflaquata is the best safe medication which will relieve the constipation, and also if we give that shunti churna, it helps in proper digestion. So nausea and all will not be having that much related to this iron related complaints. And Amlaki Rasayana, when we supplement along with this iron, it will help in reducing this oxidative stress because of the iron, which give rise to this type of complaints. Sorry, even asking the patient to increase the fiber in the diet also, and having good amount of liquids will also help in relieving the constipation.
Okay. Thank you. Any question from audience? So I think there are no questions from audience. Thank you so much to all experts, Dr. Mansi, Dr. Vishala, Dr. Anita. Dr. Khoth is not here, but thanks to her also. Then Dr. Shivani for case presentation, and to all audience for your patience listening. Okay. Thank you.
Thank you. Thank you,
Thank
madam.
you so much, ma'am.
Thank you.
Thank you.
Thank you so much, ma'am.
Thank you, ma'am.
Yeah.
Madam, regarding feedback link, will you give it on WhatsApp?
Thank you, madam.
No,
Thank you.
it is in chat box.
Thank you.
Thank you.
Ma'am, can you please again share the feedback link in the chat box, please?
Okay, okay. We are sharing. Yes, feedback link is there.
Yeah, got
Ma'am,
it.
yes, ma'am. We
Thank
got
you.
it. Thank you, ma'am. Thank you so much.
Very nice discussion. Thank you.
Yeah, thank you.